Hi, welcome back. We're going to pick up with chart 10 abbreviations. Some of these are going to have videos that I want you to watch. I want to give you kind of a deeper insight to some of the careers that are available here. But from the beginning, so Q to H, this is every 2 hours. Q for every, H for hour, number for how many hours, right? So because we go down here to Q3H every 3 hours and then Q4H every 4 hours, right? So on and so forth for however many hours you want, right? Those are just examples. All right, QHS, this is every night at bedtime. So I think this is like every hour of sleep, right? The hour that you go to sleep, that's at bedtime, right? So I always think of S for sleep. Okay. All right. QNS. So this is quantity not sufficient. Quantity is a number. So for antibiotics, sometimes you have to have a certain dosage level, or you have to take them every so often, or for a certain amount of time, right? So if you don't have a high enough quantity of antibiotics in your system, it's not going to be sufficient. It's not going to work. If something is not sufficient, it's not effective, right? It's not enough. Okay. QOL, this is quality of life. So a lot of people that decide they want to do like a DNR, a do not resuscitate, is in the event that they're actually resuscitated, what kind of quality of life would they have? That's a big concern for a lot of patients. Also, for patients that are deciding whether or not they want to go through with a certain procedure, they'll think of, the quality of life. Is it going to improve with that procedure? Is it going to decrease with that procedure? Right? Is it a risk or a benefit? Okay, so quality of life, QOL. Okay, QS is quality sufficient, just like QNS was quality not sufficient. QS is quality sufficient. I keep saying quality. Quantity. It's a number. Quantity. Quantity is sufficient. Whew. All right, QT, quart. This is a measurement of volume. A quart, there's 4 quarts in a gallon. R, this has 2 different meanings. So it can be respiration. So normal adult respirations are 12 to 20 respirations per minute. A respiration is when you breathe. One whole respiration is a breathe in and a breathe out, right? R can also mean rectal. So we'll use this a lot when in nursing with the type of thermometer we use. If it's a rectal thermometer, then we need to annotate it as R for rectal. Because you don't want to put rectal thermometers in your mouth, right? So also, fun fact, rectal thermometers are red, okay, as opposed to oral thermometers are usually blue when you talk about digital thermometers. All right, right, like the right arm. Well, that's my right arm, okay? Right leg, right eye, okay? It can be abbreviated as an R with a circle around it, right? And there's an R inside, all right? Or it can be a capital R lowercase t. RBC, this is a red blood cell, an erythrocyte. Erythro means red, cyte means cell. Red blood cell. Okay, they carry oxygen. Very important to our body. Yeah. RDA, this is recommended daily allowance. You'll see this a lot on nutrition labels. Recommended daily allowance of sodium, recommended daily allowance of calories, right? How many grams are you supposed to be able to have a day? All right. REM, this is rapid eye movement. Rapid eye movement is what happens when you sleep. Like if you ever look at somebody and they're dreaming, kind of their eyes under their eyelids are kind of going back and forth and back and forth. That movement is called rapid eye movement, and it's actually a phase of your consciousness while you're sleeping. Right lower quadrant. So if we were to look at this is kind of a review from chapter 7, section 2. Okay, we can divide this abdomen into 4 different quadrants. Okay, and it's from the patient's perspective. Okay, so right lower quadrant is this one over here. This houses the appendix, part of the large intestine, part of the small intestine, right? So that's the right lower quadrant. We're also going to talk about RUQ, which is right upper quadrant. That houses like your liver and part of your stomach, part of your small intestine, part of your large intestine. Kind of a big deal. Big area. All right. I guess they're all a big deal. Okay. RN, registered nurse. So registered nurse, that's a nurse, right? In the process to become an actual full-fledged nurse, you have to go and get either an associate's degree in nursing or you have to get a bachelor's degree in nursing. And you'll do the certificate training through schooling, and then you, when you go to get your nursing registration, you have to pass an exam. All right. Ribonucleic acid. So I found a nice little picture of RNA versus DNA here. So RNA is actually only one strand, whereas DNA that we talked about, the genetic material, is double-stranded. It's a double helix. A helix is the fact that it's spiraling. Okay. And another difference that I want you to see here is that RNA has uracil. It has this dark gray nucleic acid. It has uracil, but it doesn't have thymine, right? So you see, it's kind of like a purplish color almost. I don't know, gray purple, whatever. This one, thymine, you see it over here on the DNA, but you don't see it on the RNA. So RNA matches up the thymine with the DNA with uracil, okay? So when the DNA unzips to be able to duplicate itself, and that's when the RNA comes in, it'll pair up, uracil will pair up with thymine. So, fun fact. Okay. All right, where's this chart? There's the chart. Okay. RO, this is R/O, both uppercase. This is rule out, right? If you go into the hospital with abdominal pain, okay, your doctor is going to go through a process of ruling out what it's not going to be. And they're going to rule out the more severe, life-threatening conditions first. To rule out is to make sure that it's not a factor, right? So if you go to the hospital and you're throwing up, okay, they're going to rule out stomach cancer. They're going to rule out some sort of infection, right? Rule out an ulcer. Okay, maybe you just had some food poisoning. I don't know, right? So the doctor will go through this process of tests and examinations to rule out anything it's not. Range of motion. Okay, so this comes into effect with a lot of injuries, right? Generally, when something starts to bother us when it's an injury is when either it hurts or we can't move it like we could. Okay, part of that's just getting older, unfortunately. But range of motion is how far you can actually move, right? Okay, so like this is a full range of motion, okay? My father actually tore his rotator cuff when I was young, and he could not lift his arm above this height. He just couldn't do it. He couldn't do it. Even if he took your arm and pulled it up, he couldn't. Like, it hurt. So he had a limited range of motion, ROM. RR, this is recovery room. This is generally where you go after surgery when your body can kind of relax and try to re-regulate itself, get the drugs, the anesthesia out of your system. It's where they can keep a close eye on you. You know, if you get sick from the anesthesia or there's some sort of complications, the recovery room is equipped to help deal with that. RT, this is respiratory therapy, or it can also be respiratory therapist. Okay, so it can be the field or it can be the job. So I have a video that's like the day in the life of a respiratory therapist, and I thought it was super cool. It actually gives a pretty good look at the kinds of things that respiratory therapists do and what they deal with. It's actually a really great profession. It doesn't require that much schooling, right? So it's not super expensive to get there, which is kind of a good choice for some people. So RT. RUQ, we kind of talked about this, right upper quadrant of the abdomen. RX. So this generally means prescription, right? You'll see RX, capital R, lowercase x on pharmacy labels and pharmacy signs if you're driving down the road. If you didn't notice it before, now you will. So it means prescription. It can also mean to take or a treatment. Okay, they all kind of mean the same thing in medicine, right? If you take something, it's generally a treatment. Okay, most treatments that you take are prescriptions. Okay, so tomato, tomato. Now, without. So without is S with a line over it, right? You got an S, and there's a line over it. That means without, or you can do the W/O, which that's kind of a layman abbreviation. It's not super technical. If you want to be like super smart and technical, it's S with a line over it. So if you wanted to do the opposite of this with, it would be a C with a line over it. I don't know if you remember that or not from, I think it's probably chart 3. So that was a while ago. But with is a C with a line over it. Without is an S with a line over it. Okay. SA, this is sinoatrial. Sinoatrial. So this has to do with the heart. Okay, we'll get rid of those. Okay, so in the heart, you have the electrical conduction circuit. Okay, right? We have a muscular part, and then we have an electrical part. Okay, so the pacemaker of your heart is the SA node or the sinoatrial node. Okay, to abbreviate sinoatrial is SA. That's spelled wrong, but it's sinoatrial and it's SA. So that's the pacemaker of the heart. The SA sends signals through the atrium to the AV node, which then goes through the bundle of His, through the bundle branches down to the Purkinje fibers. So this SA node is very important when we use an AED and you put a pad here and a pad down on the bottom left. The whole point is to hit this SA node with electricity first. That's what we're trying to stimulate. SC, this is subcutaneous, right? We learned this in chapter 7, section 3. Subcutaneous means below the cutaneous layer, which is your skin, right? So this is that fatty layer under your skin with the connective tissue, lipid cells, that kind of thing. And that's SC. Can be lowercase or uppercase. You pick. All right, surgical intensive care unit, SICU. SICU, SICU, Surgical Intensive Care Unit. Okay, so with this is where it's an ICU, but this one may specialize with surgery patients, right? There's some other things that they have to think about, like internal bleeding or I don't know, internal bleeding, pain, that kind of thing. So SICU, it's kind of a specialized unit in a hospital. SIDS, this is sudden infant death syndrome. I will be posting a video on this. This, unfortunately, is the cause of the majority of infant deaths in the United States. Generally, it's because parents get lazy or they're not educated. Ultimately, the child does what a baby is going to do, and the parents don't pay attention close enough. Or they don't remove the objects that they can suffocate themselves with, right? So sudden infant death syndrome is generally more accidental. It's very easy for children or babies to impair their airway through suffocating themselves with a blanket or a stuffed animal, that kind of thing. So, yeah, SIDS. It's super important. I'll post a video on it. All right. SLG. Give the following directions. So this is generally brought down from a physician level. Give the following directions. Have the patient do blah, 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 blah. Right? SM, this is small. You've probably seen this on clothes. Or maybe you bought these clothes for your child. I don't fit in the small anymore. Haven't for a long time. But small means small, right? It could be like a like a small C collar, small splint, small. It's a descriptor. SOB, and this isn't son of a whatever you want to put in that to finish the phrase. It's short of breath. So if somebody is short of breath, that means they can't quite catch their breath, right? They're going to be talking in very shortened sentences. Okay, they're short of breath. It's a respiratory distress problem. All right, SOL, it's solution. This is a blending of multiple things in a liquid, a solution. Spec or spec is specimen. Specimen is a part of something that you want to analyze, right? So you could get like a urine specimen, right? So where you take some urine to study it, see if you can figure out what diseases they might have, or same thing with stool. Sputum, vomit, right? You can all get specimens of this and analyze them. Now, 1/2. This is 2 S's with a line over it. 1/2. 1/2. It's half of something. All right, signs and symptoms. You guys have seen me in class abbreviated as S&S. That's an ampersand and, right? You can also do S/S, tomato, tomato. But signs and symptoms, this is going to be every patient that has a complaint ever is going to have signs and symptoms. Signs you can see, right? Like a traffic sign. Symptoms are something that they have to tell you, right? SSE, soap solution enema. I'm going to be posting a video on this so you can kind of see exactly what it is, what it's used for, blah, blah, blah. Staph. If you have a staph infection, okay, it's short for staphylococcus. Staphylococcus can very easily turn into cellulitis, which is a skin infection. You can get a staph infection in your joints, in your skin, under your skin, in your eye, in your ear, right? These are pretty common. Dime a dozen. Stat is at once. Like you've probably seen the medical shows or medical movies. They're like, I need an IV. Stat, right? That means right now, right? Right now. Okay. STD, sexually transmitted disease. These are like HIV, hepatitis, gonorrhea, chlamydia, syphilis. Goes on and on. When we go through the reproductive system here in a few weeks, we'll be learning all about sexually transmitted diseases. Okay. Streptococcus. We most commonly find strep in our throat, right? Like strep throat. That's literally the bacteria Streptococcus, which means that it's a cocci-shaped or a circular-shaped bacteria that grows in chains. But you can get that in your heart. You can get it all sorts of places, right? It's just a type of bacteria. Surge. This means surgery or surgical, like a surge nurse. Surge department literally means surgery. Plain and simple. SX is a sign or a symptom individually, not SNS or S/S, right? That's signs and symptoms. This is a sign or a symptom. Okay, moving on. Temperature, it's capital T, which is usually how we abbreviate it on vital signs, or you can do temp with a capital T. Okay, so I hope I was descriptive with this. There's going to be a few videos that I'm going to add, but let me know if you have any questions. Thank you.